Hi, I'm Dr. Paul from Absolute Dental Care, the Confident Smile creator. As a dentist, I often get asked by patients if they actually need a crown or not. You see, whilst there is a cost involved in getting a crown done, there's also the very serious implications of not getting a crown done. And some of the things we see are things like fractured teeth, broken fillings, and sometimes even the crack goes towards the middle of the tooth and either kills off the nerve of the tooth and we get a lot of pain in the tooth, or sometimes even just the fracture of a tooth alone can actually be very painful. And when we're actually doing our crowns, we actually offer a 15-year guarantee on some of our crowns. We get that little guarantee card, so there's a bit more confidence that the product is actually going to work and last you for a long time. We also provide a personalised take-home diagram, so you can take it home to your family or friends, and you actually explain to them about why you actually need a crown. So after all, the big begs the question of what's the number one way to tell if you actually need a crown? Well, the way we look at things is this, and we'll draw some diagrams. If this is our tooth, and we have a large filling in that tooth, the wider that filling is, the weaker the outside parts of the teeth become. And one of the things we look at is any tooth that's 60% filled or above is a tooth that's overloaded and a much higher risk of breakage of us. And that's for this reason. When we have our opposing tooth sitting here like this part of the tooth hits the filling and wears the filling down more and more and more over time. And when we have our food in between the teeth and we actually grind and we pulverize that food so we can swallow it, even more pressure gets placed upon these parts of the tooth, and it causes the tooth to start to flex back and forth. And as it flexes back and forth over time, we get these little tiny cracks that propagate through here until one day off falls the corner of the tooth. And that's when someone comes in with a bit of a broken tooth. What can also happen is that the cracks can actually move its way down towards the nerve of the tooth and either crack that tooth in half or give you a lot of pain and it kills off the nerve of the tooth. So the last thing we want is that tooth to split in half. So what do we do? What is a crown? Well, once again, if this is our tooth, we have that large filling inside the tooth and we need to hold it together. What we do is we trim back off about 1.5 millimeters off all the way around the outside of the tooth, and we make a cap or a crown to sit around the outside of the tooth, and that helps lock it and hold it together, a bit like a thimble if you'd like to look at it that way. These things are very strong and they do last for a long period of time, and usually we get a 10 to 15 year life out of most of our crowns if provided you look after them. Another thing that we actually do these days is slightly more conservative, and it's the way we're doing a lot more of our teeth these days. If that's our filling, and even if the filling spilled over to the outside part of the tooth and all this is filling material, what we do is we remove that old filling material, we assess what tooth's left. It's very thin across here, we'd actually cap it across there as well, and then we make a porcelain bit to glue back inside. And these things are called porcelain bonded restorations, or PBRs for short, or the old term was an onlay or an inlay. So that's how we determine whether a tooth needs a crown or not, and basically what a crown is. If you'd like to find out whether you need a crown or not and get a personalised take-home diagram to show your family and friends, please give us a call here at Absolute Dental Care on 3870 1300. I'm Dr. Paul, the Confident Smile Creator. Catch you soon. Take care. Bye.